Speaker is Michael McBane. Just a quick intro on Michael. Michael McBane has been the National Coordinator of the Canadian Health Coalition since 1995. Michael he has over 25 experience working in coalitions on issues relating to Medicare, privatization, food and drug safety, and economic justice. He's the author of Ill Health Canada, Putting Food and Drug Company Profits Ahead of Safety, published by the Canadian Centre for Policy Alternatives in 2005. Michael studied political science and technology in Ottawa, and he studied in Paris. He was a senior researcher from 1982 to 1990 on issues on economic justice and the Canadian Conference of Catholic Bishops. From 1990 to 1993, Michael was the national coordinator of the Action Canada Network, where he campaigned to expose his threats to society, democracy, and the environment posed by the North American Free Trade Agreement. Please help me welcoming Michael McBane to the stage.
Thank you very much, Nathan. It's an honor to be here in your community. And like Wendell, this is the first visit I've had to such a beautiful temple. The Canadian Health Coalition has organized a tour across Canada. So we're here today on our journey across the country to help start a conversation about the future of our healthcare system, because the Government of Canada has made some very serious changes which will affect our lives in the future, and we should be discussing the implications. The federal government has decided to change the way it funds healthcare, and it will lead to cutting back money given to provinces to provide healthcare. And it also means less money for smaller provinces and more money for the provinces growing fastest. And the third change in financing is, in a few years, they're going to link the transfer to economic growth. So if the economy grows, the transfer grows. If the economy shrinks, they cut the transfer down, which makes no sense. Because when the economy is doing badly, people need more health care. Because unemployed people and people in economic distress are not as healthy as when the times are prosperous. So these are very serious changes. And we believe these changes have been made in the back room. These changes were never discussed in the media. Canadians did not say, we want this. And so now is our chance in the next year. Before we vote for the next federal government, we need to be clear of what we want in our healthcare. We need to be clear of which parties are going to promise which healthcare platforms. And we are urging all Canadians to push all the political parties to have an ambitious plan for the future of healthcare. A plan that will take care of our aging population. We have no plan to care for our senior citizens. And we know right now we are not properly treating our elders. We are warehousing seniors with no standards. The province of Ontario has no nursing standards in nursing homes. And that is completely unacceptable. We need to provide care with dignity for our elders. And we need to change our healthcare system from just focusing on hospitals to having the care follow the patient home. We need more home care so people can age in their home and be supported in their home with their families and not have to move to hospital, not unnecessarily. And the other thing we need in a new system is we need our prescription drugs covered. It makes no sense that when you're in a hospital bed, the drugs are free. When you go home, you could pay as much as $10,000 for cancer treatment because you're not in hospital. That doesn't make sense. Our medication should be part of our public insurance system. And the irony of having a universal public insurance system is it costs less money than having people pay privately. We have a proposal for a universal public drug plan which would cover all Canadians, free, and cost us $10 billion less than we are spending today. So the reality is we cannot afford not to have more and better public health care. Because we have seen the stories of the United States. They are spending more than anybody on the planet, and yet they are the most inequitable country, with millions going without health insurance because they can't afford it and going without care. And so we come from a tradition in Canada of pooling our risk, because we were a very small population. We pooled our risk, and this happened back in the 1940s. So we came out of a major world economic depression, a major world war, and we were poor in Canada. This started in Saskatchewan. Started with farmers and other workers, and they couldn't get medical coverage. So they said, okay, we will cover ourselves, we will form a cooperative. So the cooperative movement established the first insurance in Saskatchewan, and that system grew, and Tommy Douglas was the hero. Tommy Douglas was an immigrant to Canada, and he was voted the greatest Canadian in history. And part of his major dream was building public Medicare. And people would say to Tommy Douglas, Tommy, where would we get the money to pay for health care in such a poor place? And he said, we'll get the money from the people who have the money, which means progressive taxation. That's how we need to fund our programs. And so another message when we travel the country is to warn people about politicians selling you tax cuts. In fact, there's a prime minister right now who said all taxes are bad. Stephen Harper said all taxes are bad. That's a very radical statement, because it means all public services are bad. Because you cannot have public services without taxes. So it means your fire department is bad, because it relies on your taxes. This is a dangerous philosophy. And we need to be proud to be paying our taxes, to build the strong services we need for ourselves, our parents, our grandchildren, our grandparents. And so we do have to be honest, and we do have to be clear, and our politicians have to be honest, to get a modern system of healthcare which could be the best in the world. We need to fund it with our taxes. The current federal government gives away $80 billion a year in tax cuts. That's a lot of money that could go to home care or pharmacare. That's a lot of money that could go to social investment for our future. And he's promising, the Prime Minister is promising in more tax cuts in the next election, because he's saying there'll be a surplus. But one of the reasons there'll be a surplus is he's taking money out of healthcare from the provinces. So he's taking money out to give us tax cuts. Can you get an operation with a tax cut? Of course not. Tax cuts are useless. When you take 1 cent off the GST, that's 1 penny off your coffee. That's more than $6 billion lost. That would be enough to fund a universal drug plan. It's very damaging when you keep cutting taxes. And our needs are growing, our population is growing, and we need to invest in our future. We need to invest in our social programs. So this is really important, that we speak up and that we demand of our federal government some leadership, and that we value as Canadians that all people should have universal access. It doesn't matter, or it shouldn't matter where you live. It shouldn't matter where you work. it shouldn't matter that access depends just on those who have the money. And so this universal right is a human right and is part of Canadian identity. And so we need to be vigilant, we need to stand on guard, we need to speak to our politicians and tell them we will not let anyone take our universal public health care away from us. It took a long time to build it. It needs to be improved. We need new investments. And we cannot afford to lose our universal public health care. So we are hoping that you will spread this word. And you know, I'm sure, that politicians are very sensitive to what their people are saying. And when they hear you talking about this, and your friends, your family, this gets back. They don't lead, they follow. And we can push them in the right direction. So I encourage you to be vigilant, to spread the word, and to keep Medicare strong. Thank you.